Start small. You can start with a small study of a dozen people or 20 people who seem to share concerns about vision and explore it with the money that you do have. But I think we will need more money for clinical research, even if the basic researchers seem to have their own sources, because basic research does apply to more than one disease. I think it is known that the polio virus didn't just hit spinal motor neurons, that it also hit central motor neurons. And that there is documentation of change, and there are changes seen on MRI that would correlate with that. So I think it is, a given now for most people dealing with it. Because of that, you would expect to see changes in post-polio syndrome affecting central pathways. I have seen individuals who have developed upper motor neuron findings, which is not something you would expect to see, but with changes in central pathways, which are upper motor neurons, you can see the emergence of brisk reflexes, even upgoing toes. And things that appear to be spasticity related as opposed to motor unit or weakness related. You can find changes in brainstem motor neurons, especially in people that had bulbar polio, where there was documented clinical evidence in the acute syndrome. Affecting weakness in pharyngeal muscles, weakness in accessory muscles of respiration, and other cranial nerve areas. So I think central motor effects have been well seen. Some interest in effects in not voluntary muscle groups on a central basis, but involuntary muscle, autonomic nerve centers in brainstem and brain areas, effects it might have on blood pressure, effects it might have on cardiac function, effects it might have on sleep. And I think there is published evidence to say that these areas have been able to be monitored and seen to be involved as well. Are there cognitive changes in post-polio? People describe brain fatigue. And I think that is a real phenomenon. What the actual hardwiring of it is, I don't know. Because most of the pathways that I just indicated aren't typically involved with concentration and alertness, with the exception of the reticular activating system in the brainstem, which could be at behind the descriptions of brain fatigue and central fatigue. So I think there is growing basic science evidence that that the brain is involved as well as the spinal cord, and that the symptoms in post-polio may include symptoms in those areas as well. Mm-hmm. And that was why I wrote my little grant application to look at signs of inflammation that might be affecting brain structures. Didn't get funded, but I think there is going to be more and more attention paid to that. Certainly, work being done back east, and I forget who the researcher was, with magnetic resonance spectroscopy. I think it was Dr. Trojan was working with that, looking for changes in brain chemicals that would correlate with changes in nerve activity when you can't actually pick up atrophy or nerve cell loss on simple imaging is going to be very important, to follow treatment protocols. A lot of work being done in spinal cord injury, which is an area of tremendous demand. In replacing spinal long tracts. I think a lot of that research is going to be very applicable, whether it's growth factors or stem cells, to polio survivors. So I know that spinal cord injury groups are working very closely with some polio groups, at developing these technologies, but again, it's still very much at the animal research level. It's not being done in people yet.
Years?
5 to 10 years. I would say. There was one pilot study done using a nerve growth factor, insulin-like growth factor. It was being studied in Lou Gehrig's disease, ALS, and the clinician who was running that study, had a group of polio patients that he wanted to see if it would be of help to them at all. Studied it, found, some improved recovery from fatiguing exercise, but no obvious change on muscle biopsies or nerve biopsies. So it was suggestive, but then he didn't have additional funding to really carry on a larger study. So I think there are unplumbed areas that are crying out to have research done in them, where we are at a point where we could be doing clinical trials, and it's just a lack of funding, lack of interest on the part of drug companies. It's an orphan disease in a way because it's a disease that's felt to be dying out.
The goal of it is to, like I said, twofold. One, to encourage people to think that yes, it's important to study polio. Number two, to help young researchers get data so that they can use that to apply for a larger grant or for seed money. And the one 2 years ago, or it wouldn't have been 2 years ago, 2 grants ago, was the young lady that did the research on polio people or women and menopause and did that large survey of that. There really has been very little done with women and disabilities in reference to menopause and some of the women's issues. And so she did a good job with the survey and was published in several journals, and as a result of that then she applied to the National Institutes of Health for a grant and received a 3-year, I think, I'm not sure if it was a $250,000 or a $500,000 grant to continue to do more work with